I wanted to create a space where health intersects media and sports and entertainment and politics and just health. I'm Nurse Noel, and welcome to FlyHealth. Hey, y'all, welcome back to FlyHealth. I know. Merry Christmas, Happy Thanksgiving, Happy New Year. It's all wrapped up into one. I'm your host, Nurse Noel, and I just want to give you a little backstory for those who are new to my channel. I am Nurse Noel. I'm so excited to be on this journey and to take this journey. And the destination, I don't even know. I don't even care. But the journey is fun. Let me just give you a backstory. I've been a nurse for 27 years. This year makes 28 years that I've been a registered nurse. I started when I was 2. And yeah, I love everything about nursing. I love everything about health. But I kind of branched off and I kind of did something that wasn't really being done. This is before TikTok, before Instagram. I started merging health with entertainment and sports. I have a background in entertainment and I just wanted to merge the two because I was tired of living two lives. I was tired of living two lives. You know, Nurse Noel, Noel the nurse was scrubs, no makeup, no hair, etc., etc. And Anthea was like this fly girl, like this fly chick, always with the latest fashion and always, at the hot spots, and I just wanted to merge the two and merge the two worlds, and it's been good ever since. So I worked with Dr. Oz on the Dr. Oz show for 6 seasons, 6 seasons, and that was a blessing. And also I wrote for Old Magazine, I wrote for Essence Magazine, I wrote for so many different publications, Healthy You Now, and I also was a executive. I was an executive at Walt Disney Television. So that was my last job. But I decided I wanted to veer off and do my own thing. And, God has been definitely blessing me. And I have a really good team. I have a really great team. And I'm so happy. My niece and nephew are my everything. They are the set designer. They are the executive producer, the line producer, the first AD, the second AD, the grip, the gaffer, everything. But they're not here with me today. And I just wanted to give a shout out to my niece and nephew. Hey, Madison. Hey, Chase. But okay, so let's get into it, right? I'm going to take you on this roller coaster ride because there's a lot of ebbs, a lot of flows. And yeah, this is Nurse Noel with Fly Health. Stay tuned. I thank you for tuning in. This is definitely a labor of love for me. So let's get into it. Why was I missing? I've been missing for about 4 months, missing in action from Fly Health. And it's a good reason. I had surgery. I had a breast reduction. In my previous episodes, I said I was going to go from a 34J to a C cup. Well, I didn't go to a C cup. I went to a D cup. Still a handful, still a handful. But they took off 7 pounds, 3.5 pounds on each breast. And as I was telling you before, my back, my shoulders, my neck, everything was being affected. And I didn't think they were coming from my breast. I didn't think that was the source. That just, as a nurse, sometimes you just don't think as a nurse. And I had a T2 injection done. I had a thoracic epidural steroid injection. And I just was like, this pain, I don't know how to deal with it. I don't know how to deal with the pain. And I got my big girl drawers on and I did it. So let me just talk to you about the breast reduction journey. I had big breasts since I was little. I mean, puberty hit and it was like explosive. I was getting attention from all different directions. Uh, I didn't want to wear bras. I was very embarrassed. My mother didn't know how to deal with it because she has a little girl. And at the age 11, I already was probably like a C cup. And when you're getting attention misguided attention, wrong attention from boys, from grown men. It just, it did a lot to my self esteem. It did a lot to my self esteem. I started to mask my breast. I started to wear baggy clothes. I started to tie them down with ace bandages. I started to do things that that girls do who don't know how to deal with having these large breasts. So teenage years, 20s, 30s, I just was used to them. I went to the Dane shop. The Dane shop is a shop in Morristown, and they were the best. I went there with a D. They were like, "Oh no, you're a G cup." And I said, "A G cup?" So I was wearing a G cup, and you know, your weight fluctuates, it goes up, it goes down. As my weight went up, my breast got bigger. As my weight went down, my breast stayed the same. So I ended up with a 36J. Let me tell you how difficult it is to go bra shopping. Let me tell you how difficult it is to wear clothes. Can't wear spaghetti straps, can't wear things that don't require a bra. You can't go braless. Everything that you wear kind of pornifies it. And it was just an ordeal that I just did not want to deal with. I finally got the courage to get a breast reduction in 2017, and my insurance denied it. Horizon Blue Shield denied my claim. And at that time, I think I was a 34G. They denied it. And I just went with the flow and just realized that this is just what it was. I'm just going to have big breasts. I'm going to be a part of the big titty crew. And that's just what it was. So I don't know, this year was the year of me. Last year I got liposuction, which I absolutely love because you know, you get older, you start gaining weight in places that you never gained weight in. And I just, I know, I just sprouted some wings and I decided I wanted to do this. They approved me. And that was my last episode when I told you that they approved your girl. And I'm so excited. Well, September 9th was the day. It was so funny because I remember September 8th, the day before, I taped for Fox. For Fox News, a back to school health with children type thing for Good Night New York. And it was fun, you know, Ryan and Crystal, they're always a good time. But I had it in the back of my mind. Tomorrow I'm actually going to get rid of these breasts. And I got depressed. With anything, separation anxiety is so real. You go through all of these emotions of loss, is grief. You're like, I'm going to get rid of something that has been with me for this long. And I didn't know how to deal with it. So I put in my mind that I'm going to be wearing everything from tanks to spaghetti straps to backless to, and this pain is going away. These dark marks, these indentations on my shoulders are going away. And guess what? I prayed to God and he gave me the strength. So I woke up, my surgery was scheduled for 7:30. I woke up in the morning and my friend Yolanda English, who is a nurse, she took me and we drove to Old Bridge Surgical Center where Dr. Parcell, let me just tell you, Dr. Parcell is the greatest, the best breast surgeon ever. Now, I work with breast surgeons. I work in the OR, I work in the PACU. I know plastics, I know it. She is so dope. And I was concerned about the fat, you know, the fat back here. For those who are watching, those who are listening, I'm talking about the fat, like right underneath your arms. I was concerned about that. I was concerned about something that they call dog ears, which is on the sides of your breast. You just have like extra breast on the side of your breast. Like I was, and that's usually a surgical complication. I was just worried about everything, and I didn't want to be intubated. It was just so much. But I got through it, and Yolanda took me home, and then I went to the post-op visit the next day. Let me tell you how encouraging she was, how thoughtful she was, how empathetic she was. That's what you need when you're dealing with a surgeon. I mean, you really need to do your due diligence and your homework when you are choosing a surgeon, especially when it's something that is aesthetic. They intubated me with an LMA. So let me explain to you. You have an ETT, which is an endotracheal tube, and you have an LMA, which is a laryngeal tube. And the ET tube goes down into your trachea, and the LMA sits right above here, right? So it's up, but it's still artificial airway. You're on a ventilator for both of them. So I had an LMA. My surgery was 3.5 hours, and I got blocks. I got which is nerve blocks, so that I wouldn't feel any pain post-operatively. I got medication during and after the surgery, but no one ever tells you about that burning pain. Let me just tell you about the burning pain. My patients usually tell me like, "Oh, it's this burning, it's this burning." And I'm like, what is this burning?" Well, guess what? I found out what the burning is. The burning, it feels like someone literally lit your extremity on fire. It's not a pain. It's not relieved by pain medication, no narcotic, uh no NSAIDs, nothing like that, but it is a burning pain. The next day when I went to the post-op, I never saw my breast. She took off the bandages, and my cousin Leanna Walcott came with me, and she was in the room because I don't know. I don't care. Like, you want to see it? Everybody see it. Everybody see it. And I opened my shirt, my sweater. I had a hoodie on, and she unwrapped me, and I looked. And first of all, they were sitting up here, like right up in my neck. And I was like, they're so small. They're too small. They're too small. They're too small. And Leanna's like, no, babe, it's not too small. It's not too small. And I'm like, it's too small. It's too small. And she's like, no, it's not. They look good. And I was used to that J cup, that big breast hanging, imagine having a 7 pound weight around your neck all the time in the shower, when you're driving, when you're sleeping, and it's gone. And I looked, and it took a while to get used to it. I have what is called an anchor scar. So an anchor is what it looks like. An anchor. Comes down here from the nipple down, and then underneath it goes like this. But Dr. Parcells extends her incisions a little farther so that she can drag down some of that axilla fat. So baby, summertime is on. I am a new person. I feel so good. I don't feel the weight. And now I'm like 3 months, 4 months post-op. I love them. And the first thing that everyone says, why didn't I do this sooner? So let me tell you, if you are battling or in your mind, just going back and forth with yourself over something that you want for yourself, do not deprive yourself. Do your homework. Do your homework. Look to see the reviews. Go and talk to the doctor. And it's usually better to go to someone that someone else knows. Utilize your healthcare professionals. My friends, they'll come to me. They're like, "Hey, have you heard of Dr. So and so? Have you heard of Dr. So and so? What is this technique? What is?" Utilize our expertise. Ask questions that you're embarrassed about. Ask them anyway, because it's your health and it's your life. And nobody wants to have lopsided titties. I'm just saying. I mean, who wants to have lopsided titties? I mean, I said it. Who wants to have titties that are not, or breasts? Who wants to have breasts that are not symmetrical? Who wants to have breasts that are just looking crazy? And just remember, they are sisters, not twins. They are sisters, not twins. We are always taught that in nursing school and in the hospital and training that it's very difficult to have them identical. But she did a damn good job. She really did. And I'm happy. I look better in my clothes. I feel better. I have this confidence that just like now I'm like, what? I'm about to go. So I'm taping next week and I'm excited. I've taped since I've gotten them done, but I'm wearing things that I feel don't make me feel like a target. Don't make me feel like I'm just, you know, the camera's on me. Everybody's looking at me. It's just breasts. I went to a fitting at the Dane shop and I am a 36D. Some bras I'm a double D, but I'm pretty much a 36D and I'm happy. So I went up D, double D, E, double E, F, double F, G, H, I, J. 9 sizes. Praise God from whom all blessings flow. I'm going to leave Dr. Parcells' number and her website. You can find her on Instagram. I'm going to show it on the screen as you can see. And if you're struggling with anything, go for a consultation. I mean, they're not free. The consultations are not free, but it's worth it. Sometimes you might decide that you don't want to do it. But you know what? I'm glad I did. I'm glad I did. We'll be right back. I like this part of the show because it connects me with my viewers and my audience. I got a good one. Let me read it. Dear Nurse Noel, I went to the doctor and I got some blood work done, and the doctor explained to me that my hemoglobin A1C is 6.2. My doctor explained it to me, but I just wanted a better understanding of what that means. Please let me know. I like this topic. This is near and dear to my heart. My mom was diabetic, and my paternal grandmother were both diabetic. So it's coming from all sides, both sides, both sides. What I do know is that the hemoglobin A1C is a blood test that kind of keeps an eye on your blood sugars and how your body metabolizes the blood sugar over the past 3 months. So if you get a hemoglobin A1C in January, you're not going to get one in February. You're going to go get one at the end of March or the beginning of April. So that's how it usually works. 5.7 to 6.3 is pre-diabetes. Anything over 6.4 is diabetes. And of course, under 5.7 is good. That's what you want. I actually got my hemoglobin A1C test when I was getting my breast reduction. I just said, just test me for everything. And it's 5.4. Thank God, because I am not the best eater. And now I'm going to make a conscious effort to eat better, to sustain that and to maintain that level. But 6.2 means that you are pre-diabetic. So you want to do things like you don't want to go on medication right now unless you're just like, I'm going to give up. Most likely it can go down by diet and exercise, behavior modification. So I urge you to talk to a nutritionist, talk to a fitness expert, get on some type of plan that will mean better life, better quality of life, and let's lower that hemoglobin A1C. Thank you for your questions. You can always send your questions to FlyHealthPodcast@gmail.com. This is Nurse Noel, and I'll be right back. Remember to like, subscribe, and tell everybody about this podcast. Just tell everybody that I'm back and I have some really good things coming to you this season. This is Nurse Noel with FlyHealth Podcast. Peace. Bye.